Erectile Dysfunction. Part 2. In Part 1 of this animation, we try to define erectile dysfunction and how it is evaluated and diagnosed. In Part 2, we will focus on investigations, treatment, and lifestyle modifications that are required to improve prognosis. Investigations. The choice of investigations depends on the individual circumstances of the patient. Erectile dysfunction is now regarded as an independent risk factor for cardiovascular disease and can also be the presenting feature of diabetes. So, serum, lipids, and fasting plasma, glucose, or glycated hemoglobin are performed as a baseline in all patients. Hypogonadism, or reduction in the functional capacity of testes, is a treatable cause. All men are required to have serum testosterone measured on a fasting blood sample taken in the morning between 8 and 11 a.m. Some other important tests include sex hormone binding globulin and albumin levels, along with luteinizing hormone and prolactin. Serum prostate-specific antigen should also be considered if clinically indicated. Medicines and therapy. Formal cognitive behavioral interventions should be provided by appropriately trained and experienced therapists. There may be some benefit in all men, but are probably best used in men where erectile dysfunction has a psychological origin. Sometimes medications can be used to supplement therapy, as it could be more effective in treatment. The 2018 American Urological Association Guidelines for the Treatment of Erectile Dysfunction recommends a complete history and physical and lifestyle modifications, followed by a shared decision-making approach for the existing medical treatments. Lifestyle modification. Erectile dysfunction is known to be associated with general health status, so lifestyle modification improves quality of erection. 1 year after discontinuation of smoking, patients were found to have a 25% improvement in erectile quality. In addition, studies have found that obesity is associated with erectile dysfunction. A Mediterranean diet and nutritional counseling has also reported increased erectile quality. Surgical treatments. Implantation of penile prosthesis remains an important option for men if medical treatment fails. The trade-off is a higher mechanical failure rate and a higher cost. Satisfaction rates for patients who underwent penile prosthesis surgery have been reported to be near 90%. Mechanical failure rates of prosthetic devices depend on the specific device being investigated. Overall, the percentage of devices that remained free from mechanical failure at 5 years varies from 84% to 94%. Infection rates are reported to be less than 1%. Other surgical procedures include ligating certain veins to limit penile outflow. These surgeries are only indicated when a patient has demonstrated an obstructive lesion on an angiogram or magnetic resonance angiography. These procedures should be performed only in specialist centers specializing in treatment and management of erectile dysfunction. This brings us to the end of 2 small lectures about erectile dysfunction. In case you've missed the previous one, click the one on the left. Our team of doctors and creatives have worked hard to make this animation, and we welcome your feedback. Do send us your health questions, which would help us to make future videos. We appreciate you encouraging us with a like and subscribing to our channel. Thank you.